early age, I learned that having a healthcare provider in the family is invaluable. And when somebody, a friend or a family member gets sick, there is nothing else that matters.
So originally I started doing volunteer work at Integrity House. Our primary focus was addiction treatment. However, we do provide whole person care at Integrity House. The volunteer work led me to continue my education and to pursue credentialing in the healthcare space. And I found the work to be very rewarding.
Actually, my mom was my inspiration. She started as a nurse at St. Peter's University Hospital in the 1950s through 1970s. And I remember as a very small child going with her to pick up her paycheck, seeing the hospital, and just being in awe with all of the great things that she did to help others and the community.
I've wanted to go into healthcare since I was little. I remember growing up with my grandparents in the house, and we had visiting nurse services for them, and the nurses would come in and spend time with them and what I thought was healing them, and I remember thinking that I wanted to do that.
To use my science of behavior modification and how to develop and foster human resiliency in people, because I just saw so many people with so many chronic and complex behavioral physical problems who needed that help.
Because it was the perfect mix of health sciences, which I've always been passionate about, mixed in with behavioral psychology, engineering, and law.
Based on my first volunteering experience while I was in the United States Army Infantry, I was working with a young man who had an intellectual and developmental disability. He was nonverbal, and I just fell in love with him. Decided that I wanted to work in healthcare for the rest of my career.
I identify the fact that there are so many patients suffering with cancer. I had this desire to be able to make a difference in people's lives, to be able to partner with them on their journey throughout the cancer process from the time of diagnosis until the end. I felt in the capacity of a nurse practitioner, I would be able to provide those services that match the patient's need with their expectation.
I wanted to be a nurse from the age of 7, and I lived with parents that were both psychiatric nurses, and I loved the diversity of their occupations, working in all different types of settings, and the flexibility of their jobs. But the most compelling thing that I like about the healthcare field is I get a chance to make a difference in the lives of others, and to relieve their suffering, their pain, and to lead them on a journey of wellness.
I worked with between 6 to 8 patients. I would feed them, clean them, take care of them, and I also did their laundry. And I would run up and down the stairs, no air conditioning, and I decided after that experience in August, if I could do this kind of grueling work and love it, which I did, and I had the LPNs and nurses' aides who were so inspiring and caring and selfless that I could do anything in my nursing career.
Since my early childhood, I had a dream of becoming a doctor, as I always wanted to serve people, and what other profession than doctor can allow to do that? What a humble profession. Service to mankind is a service to the God, and the best way to find yourself is to lose yourself in the service of others, quoted by Mahatma Gandhi, were followed by me and taught by my father and my spiritual mentors earlier in my life.
My pediatrician, Dr. Milton Pistowski of Nutley, New Jersey, inspired me to become a pediatrician at the age of 7 by caring for me with such compassion and patience.
I didn't choose healthcare. Healthcare chose me. Working inside a hospital as a photographer has allowed me the opportunity to witness and document a community of caregivers that pull together and succeed in treating patients during the most difficult times of the COVID pandemic. Sharing the highs and lows of that time from the walls inside of Holy Name was something I hope to never have to do again, but I was proud to be able to share our experiences publicly.
I'm a stage 4 cancer survivor, and I was diagnosed in 1999. I decided to throw a chemo comedy party. When I saw the impact that my comic perspective and mindset had on my fellow patients, their caregivers, and our oncological team, I knew that I had a reason and a purpose in healthcare. Somebody had to bring the fun.
There were only 2 careers for women in the Philippines, where I grew up, was born and raised. And so my mother, who was a teacher, asked me that question. And I said, no, I'd rather be a nurse. And she said, fine. And so that's what I became, a nurse. And today I am a nurse teacher, which means that I combined the 2 professions. And I'm very passionate about nursing education.
I wanted to do something where I could help people, and I felt like healthcare is one of the few careers where you get to meaningfully and consistently impact other people's lives.